Thanks very much, Bruce, and good afternoon, everyone. Pleasure to join the conference today. Both Bruce and Meredith had beautiful slides to show you all. I don't have any slides, so all I can show you is the inside of my bedroom, which right now I'm starting to think I should have tidied a little bit more before I began presenting. But hopefully what I've got to say will hold your attention even without the slides. And if it doesn't, you can just kind of look around my room and see what items I really should have tidied away. I think today's been really fascinating conference precisely because we've had people presenting from so many different angles on some similar themes. And the angle I'm going to be coming from is a public health one. So that's what my background and training is in. And when you take a public health perspective towards housing, some of the important questions that come up are around the role that housing plays in influencing who has good health and who doesn't, and how can we use housing improvements and other housing-based interventions as a lever to improve the health and well-being of the population. So I'm going to focus my comments on three things that I think come to the fore when you take a public health perspective to housing. So the first is around inequalities. The second is around some of the specific pathways that link housing and health. And then the third is around the cumulative effects, the way that the effects of housing on health add up over time, over the course of a person's life. So on inequalities, other speakers have already made the point that the COVID pandemic has really laid bare the huge inequalities that already existed in our society. Housing is one of the things that drives and maintains those inequalities. I think the starting point for me is that whenever we think about housing and health, we need to be thinking not just about health in general, but specifically about health inequalities. And that's not just a presentational difference, because some of the interventions that we could choose to invest in to improve health might actually have zero effect on health inequalities. Or actually, if they're done in a way that means that the main benefits go to people who are already in relatively good health, they could exacerbate health inequalities. So some of you might be aware of the Healthy New Towns programme, which was something that was funded by NHS England over 3 or 4 years. It finished last year. And one of the key lessons from that programme was that if we're going to make a dent on health inequalities through housing and development, we need to start with a much deeper understanding of the needs of local communities so that housing interventions and other interventions can be designed in a way that addresses the specific gaps that exist locally. And for anyone in the audience who's from the planning or development or urban design sectors, I would encourage you to look at Putting Health into Place, which is the final report from that programme that brings together all of the practical lessons and insights from the demonstrator sites that were involved in it. So how do we get that deeper understanding of local needs? Well, I think it's partly about paying attention to how housing environments vary at a very local level, street by street, neighbourhood by neighbourhood, because that's the level at which some of the biggest inequalities exist. Secondly, it's about bringing together data from different agencies to build up a more rounded picture of needs in that very localised, granular way. And thirdly, although the quantitative data is absolutely vital, we also need a richer qualitative understanding of people's lives as well. And that involves making sure that the voices of local residents are being heard. And that's one of the points I wanted to stress today to start with, is that it's important that we don't make assumptions, that we are hearing the voices of residents when we think about what we can do to improve health and well-being. So the second theme that I wanted to talk about was around the pathways that link housing and health and what the research evidence says about that. So by pathways, I mean the different routes and mechanisms through which housing affects health and health inequalities. And I think my opening observation would be that there are some things that are very well known about that and some things that deserve to be much better known. So I'm going to concentrate my comments on the latter. So we know, for example, a lot about the direct links between the physical fabric of a home and health outcomes, but there's also evidence about the way that housing shapes our psychological environment and our social environments, and the impact that that has on our mental and physical health. If we take, as an example, cold housing conditions, it's possibly a bad example to choose on a day when it's reaching 30 degrees in many parts of the country, and we're all, or most of us, working in un-air-conditioned housing. But I'm going to stick with that example anyway, because cold housing is one of the areas that's been best researched. There's very strong evidence about the direct effects of cold housing on health. So, for example, by exacerbating respiratory conditions. But there's also been research about how cold housing is associated with persistent stress and worry. And that kind of chronic stress, we know now, affects the functioning of the cardiovascular systems and the immune systems in a very real biological way that has a huge impact on our health. We also know from wider research that our health is profoundly influenced by things like the sense of control you have in your life, whether you feel safe, the strength of your social connections, and the experience of loneliness. And housing, including issues around housing tenure, tenants' rights, the relationships between residents and landlords, housing can play a really powerful role in shaping some of those psychosocial determinants of health. So the point I wanted to make today was that we need to invest in those things as well as investing in the bricks and mortar. The final observation I wanted to make about the pathways is that these things that I've been talking about, these psychosocial factors, things like stress, insecurity, isolation, they are for many people exactly the things that have been exacerbated by the experience of living through the pandemic and the lockdown. And among other things, that means that there's likely over the coming months and years to be higher demand for mental health care, and we need to make sure that investment in those services keeps pace with those increases in demand. The final area I wanted to talk about was the way that the effects of housing on health add up over time. There's pretty good evidence now that the damage done to our health by poor housing conditions accumulates over time. So we've got evidence from a number of longitudinal studies that show that people who've lived in poor housing for several years have worse health, and that is worse health over and above the effect of their current housing conditions. There's also some evidence that suggests that the things that happen during key moments in a person's life, key periods, which could be times of transition, times of change, times when a person is particularly vulnerable for whatever reason. Things that happen in those moments have a particularly strong effect on health. They leave a lasting impression and can really store up trouble for the future. So it's very likely that the effects of repeated exposure to poor housing conditions over a person's life add up, not in a linear way, but actually in an exponential way. And what are the practical implications of that? Well, one of them would be that it perhaps suggests that when we're identifying priorities for action, we need to be thinking about who's been living in poor quality housing for extended periods of time and who has additional stresses or risk factors that put them at risk of poor health, and then thinking about what we can do differently for those individuals and those communities, what support we can put in place. So those are the three thoughts that I wanted to feed into the conversation today. Firstly, that we need to make sure that any investments we make in the wake of COVID are designed with the explicit goal of reducing inequalities in health. We need to think more, I think, about the psychosocial implications of the housing we provide, what it means in terms of stress, people's sense of control and agency, people's ability to build positive social relationships, and so on. And thirdly, that we need to focus on the communities that have been living in poor housing conditions for many years and for whom the pandemic is yet another thing that puts their health and well-being under pressure. Thanks very much. Back to you, Jeremy.